Bob Beecher, President and CEO of MPTF, and along with Dr. Janice Spinner, our Chief Medical Officer, I'd like to welcome you to the 2014 edition of MPTF's Healthcare Summit.
Our biggest concern about healthcare right now is that it is financially unsustainable in the model in which we pay for services today.
So in today's world, the employer has had it. They're going out of business because of the cost of healthcare. And so they're doing all kinds of things that they can to mitigate the increase in cost and develop healthier employees.
Doctor care, medical care, really contributes very little to overall health and wellness.
We have to create more healthy environments. You can't expect somebody, either a kid or an adult, to make a healthy choice when there's a candy bar right here and there's a piece of celery right there. They're going to go for that candy bar every time.
I would say the biggest change that Americans could make right now is to fill their plates with fruits and vegetables. And every time you sit down, over half of the plate should be a fruit and a vegetable. If we could do that, heart disease would decline probably about 50%.
But the long-term solution that's really going to both improve the patient experience and control costs is if we have the team approach where we can have case managers, health educators, a doctor, a nurse, pharmacist all working together to provide that engagement, that patient experience. So we can take a yoga approach to managing the pain, relaxation techniques, and not just throw Vicodin, which is going to lead to long-term problems.
I am all about self-care, healthcare. And I teach people to master their basics. How you stand, how you breathe, how you walk, how you sit.
We need to change office spaces. We need to have more flexible workstations. How you hold yourself dictates a lot of your aches and pains. Movement is nutrition. Movement is medicine.
Folks are most apt to take messages and advice from a trusted primary care physician or nurse practitioner, somebody who they know, who they regularly see, and we're advocating what's called a patient-centered primary care model that encourages individuals to work with their physicians or their nurse practitioners to set goals around health that are attainable.
Health plans need to recognize the importance of primary care and the effort that we put into coordination of care, engagement of patients in their own lifestyle choices, and healthcare decision making.
Physicians, nurses, our teams are feeling so stressed that they have the 5-minute visit or the 7-minute visit or whatever it will be.
I think we have to, before we do anything else, optimize our access so that patients can come in immediately. Because when it's an emergency in your family, that's the only thing that matters.
Patients deserve to be engaged in their health care, and not just engaged, but to be empowered to take control of their health care.
Most women have chronic health conditions that impact women and men, and yet the vast fund of knowledge in those health conditions, be it heart disease, stroke, cancer, lupus, Alzheimer's, dementia, the list goes on and on. Most of the research and most of the treatments are made for, by, and in men. And we have massive gaps.
I think 2/3 of cancers are preventable. 2/3 of cancers are preventable. That's a huge number.
Everybody at age 50 got their colonoscopies, and we did our mammographies when we're supposed to, etc. We literally will save lives because we will catch things earlier and people will live longer, and it's really, really cheap compared to the cost of care.
I think people need to be incentivized to behave in a healthy manner and do that in a sustained manner. So I think people who don't smoke, who maintain a normal weight, who exercise, who are engaged in their health, should somehow pay lower premiums, that sort of thing, and I think that's what works.
Think global, act local. The one person that you have control over in terms of what you do and what you don't do in terms of your health and wellness is you. Value yourself. Take that control and be a role model for your family, for your friends, for your community, for the industry.
You have control over your health, and it's all a matter of making the right choices. That's the big message. Make the right choices.